Thank you for joining us today in today's segment of Profiles of a Caring Community. My guest today is Ken Welch. Ken is with the Coalition for a Better Wallingford. Thank you, Ken, for coming today.
Thanks for having me.
For those of you who don't know, the Coalition has been around for a little bit, and it's probably about time we had an update on what the Coalition has been doing. They were established as a response by the community, volunteers and parents, to the opioid crisis and how that was affecting our town. They now have permanent office space down on Center Street, and we just want you to get to know who they are and perhaps consider being a part of the organization and helping out with their activities. So thanks for being here.
Glad to be here.
Why don't you talk a little bit about some of the activities that have been going on, and then we'll get to the ones that are coming up.
Well, what's most exciting from my viewpoint is the community is taking over and driving this the way they should. This past year, a number of events by other organizations that have made us their focus. It's their way of saying we're endorsing the activity, the awareness that you guys are bringing to the community, the resources, the way the community has changed. We just had a 5-year review, community review, and it was nice that some of the town organizations that were there and representatives talked about those changes. The landscape has changed in terms of the resources available and what we're doing about the opioid crisis. Now, formally an epidemic, according to our government. So it's nice to see that they've acknowledged that we need to do something about it.
So what are some of the areas of concentration, either programmatically or in the town's activities that you see changing?
Policies changed. The acceptance. The first day we went to the town council meeting back in 2013 in January or December, the response, the public response from the council was, well, even if this is happening, what do you want us to do about it? Which upset a few people, as you can imagine, especially the parents of some of the dead kids, which we were at the time. Now, it's exactly the opposite. Every council member, I think every town employee goes out of their way to say, what can we do next? Because almost everybody's been affected by a death or even as bad, a family member or friend that is addicted, and how devastating that can be to families. And that's the stuff we focus on.
So one of the initiatives that I know has made a huge difference, both in the community from a strategy point as well as an activity point, has been the student survey that's been run through the high school for a couple of times. And I know that's coming up again this fall.
Yep.
Do you want to just speak a little bit about that and the effect that had on changing in the community?
Well, we use that as our blueprint. You know, the feedback from the kids is what drives everything we do. So if they're saying they have a particular behavior that's high risk and going to have some negative results, we try to address that. And I guess what's been really rewarding is the fact that we can respond as quickly as we do to that. It's, you know, a lot of these programs, you're talking about social change, they happen over a 5 or 10 year period. It's not the case with this. Because we're getting today's feedback from the kids, we're doing things, we're talking about their response. Parents are paying attention, educators are paying attention, town department heads are paying attention, and they're responding to this. It's become part of the WHIP discussion, it's become part of the strategic plan at the schools, and it's part of virtually every awareness program that we do. So, you know, you were participant in a lot of the things that we've done. We talked to coaches at the high schools, and they changed the way they run their teams. We talked to the driver's ed classes, and they've affected a positive change in kids' behaviors behind the wheel. We talked to the PTAC, and they did a big anti-drinking thing, and now kids are drinking less alcohol. They're smoking less. It's just been a very effective way. When you have hard data that's coming from the kids' mouths, people are responsive, and that's been encouraging.
And I think that's given the perspective on the education side too. It's helped them kind of formalize more of the activities and strategies they have. to address some of the issues within the school, but
Right.
just within the community at large, which has been great.
Yeah.
So I'm going to ask about a few of the programs because people may not be aware specifically, and you can give a little overview, and people may or may not have an interest in any one of those, and that would be a way for them to consider, partnering with you in the future.
Right.
So bring back the neighborhood.
That's kind of our signature activity. We get a request from a parent or family that says, there's some activity going on in our neighborhood, and we'd like to change that activity. We have kids running around, and sometimes it has nothing to do with why we were formed. Sometimes it has to do with speeding traffic. Yeah. But what we do is we bring town officials, educators, legislators to their backyard. We set up the tent, we send out invitations to the whole neighborhood, and they come around and we talk about the problems and how to make the neighborhood better. We can't keep up with the meetings. We've got another one that we've been trying to schedule for October, but October is a busy month for us. So we just haven't been able to get there. But we will. And it's a way for people, it's probably the easiest way to get involved because you're not doing anything different except you're listening to your neighbors and talking to them.
My understanding of that is that one of the significant outcomes of that is that you have law enforcement there to discuss some of the issues that
Yes.
parents or adults have brought up in the community,
Yep.
where they didn't feel that the police department was either aware of or responding. There's clearly a shift in that perspective from the neighbors that the
Yep.
officers and the department as a whole are responding and trying to address the issues that they bring to their attention. And I think that goes a long way towards the credibility
Right.
of that program. So if someone wanted to get involved in that, who would they contact or a number they would call?
Yep, just call the coalition number or send us an email. A little more better response from emails because we get something in writing and we get better contact info. Our office is open 3 days a week in the middle of the day. We've now got enough revenue to afford some administrative help, so we've almost got a real operation when we can do that 7 days a week and a couple nights a week.
Great.
We'll be even happier.
I appreciate that.
Yeah.
So Tuesday nights, you do an open mic night down at your place on Center Street.
Yeah, what we did as a result of the data-driven. So we know that kids, young adults, and teenagers are looking for things to do. One of the things that they were complaining about. So we have an open mic night. It's the second Tuesday of every month, and it's become so popular that we get studios that now show up. We get agents that come down. We get 30 to 40 people in the place. And we've had other people say that we've brought back open mic times. People really enjoy them. So there's now an open mic event every night of the week somewhere within 5 or 6 miles of the center of Wallingford as a result. That's been good.
I know one of the programs that started early on was the Hope and Support Group.
I was gonna bring that up. It's probably, a lot of stuff we do is community awareness. Some of the things that we've started to get into is actually helping families in trouble, and that's more on the treatment side. But this is a peer support group that's facilitated by a professional, and it's every Monday night. And these are parents of kids that are in trouble, whether it's alcoholism or some type of substance abuse. 83 families have been a part of that program in 5 years and growing all the time.
So no cost to that program?
Zero cost.
And where does that meet? I know it's 2 different locations?
That meets at the Yalesville United Methodist Church.
Okay.
We've been talking about opening up a second one because of its popularity and need, and hope to do so soon.
Great. So we're running out of time. Can you highlight the Red Ribbon Week program, which comes up in October, end of the month, in terms of the activities and what people can participate in?
Our signature event, we've got a week of activity, starts on our opening ceremony, which is really a community piece where a lot of different organizations will be represented talking about substance abuse, mental illness, suicide, how it's affected them, what they'd like to do about it. It's filled with a lot of music and dancing as well, appropriately so, but that's a great event. gets us kicked off. The mayor will be there. Then we've got our Bring Back the Table. Our big push is to increase the family activity, and we know that people don't eat together often enough, so we're running a fundraiser on Tuesday night. We're calling it Bring Back the Table. It's at the ELKS Club. There's 2 sittings. It's a great way to get involved. You can help. It's a fundraiser for us.
That's a great idea.
We're going to have some music. Come spend some time with your family. Get a good meal. The following night is a NARCAN training that the health department has run, bringing down an epidemiologist from the state. Anybody that's dealing with an opioid addicted person can come get NARCAN training and find out about that and walk away with some NARCAN so they can help protect their loved ones.
And the wrap-up?
And our wrap-up is the Walk of Hope, which will be lining Center Street with luminaries. Again, that's more of a celebration of recovery and acknowledgement of those that have passed, but that is a heartwarming community event. The last few years, there's been between 600 and 700 people that showed up for that, and it's really impressive to look up Center Street in the middle of the night and see those luminaries.
Yeah, that's one of the most amazing things I see in town. Now, if people are interested in getting a luminary or making one, how do they go about that?
They can contact us through our website. They can come to the office Tuesday, Wednesday, or Thursday from 10 to 2. Or Celebrate. This weekend is Celebrate, and we'll have a booth set up, and that's really where we do a bulk of the luminary sales.
Right. And your website address?
cbwlfd.org.
Great. Well, I appreciate you coming, and I just want to encourage people to participate in any or all of those activities, and it is helping to make Wallingford a better community, and the more participation we can get from the community, the safer and healthier it will be. Thank you, Ken.
Thank you.
And we'll be back in a moment. In this segment, we're joined with Eloise Hazelwood, the director of Wallingford Health Department. Thanks for coming.
Thank you for having me.
So I know you guys have stepped up with a lot of new programs and initiatives for the town, both that affect the community as well as segments of the community, and we'd love to hear about them.
Absolutely. I know most people think of us from a code enforcement aspect and food safety and septic, but we do have a very large portion concerning health education and health and wellness for our community. One of the things I wanted to talk about was the Healthy Wallingford 2020 program, which is actually part of the Health and Human Services from a federal level. So at the federal level, they establish goals and objectives to increase or decrease the incidence of illness in a community. The state then takes the federal recommendations and looks at what is happening in our state in particular. And they have created what's called a SHIP, the State Health Improvement Plan. We then take the state's plan and look at our local community, and we developed what was called the WHIP, the Wallingford Health Improvement Plan. So we've been working on our Wallingford Health Improvement Plan, this particular segment, since 2014. We do have a coalition and a group, both of town departments and our community partners, both from the medical side and from our faith-based community who are part of it. And so I wanted to talk a little bit about some of our initiatives that we're doing. So our focus areas are driven by illness and disease. I'll give you an example. One of the things that the health department is doing is trying to reduce the incidence of asthma events in children that actually equate to a loss of absenteeism. So we have a program where we will go into the home at the request of the parent to help educate and identify what's called asthma triggers, so that they can remove that from the home or have a better understanding of how to deal with it in the home, so that the child doesn't have to use an inhaler or doesn't have to go to the emergency department and in essence doesn't miss school. So that's one of the focus areas. We're also doing lead prevention, childhood lead poisoning prevention, and again, what the state does right now is we use blood tests to see if a child has been poisoned. To me, that's backwards. We're using the child as a Geiger counter to say that there's lead poisoning or lead in their environment, when really we should be preventing it. There shouldn't be any lead in a child's system. So again, as long as the pain is intact in a home, there's minimal risk for lead poisoning of a child. However, when it becomes defective, particularly in the window areas, in the windowsill areas, it creates a dust from opening and closing the window. And then the child doesn't necessarily have to eat the paint chips, which is what most people think. They just really have to ingest the dust. And that creates a lead poisoning in the child. And lead poisoning in a child can impact every one of their systems, their organs, including their ability mentally and impact their intellect as they get older. So we definitely want to stop it before it occurs. The other thing that we have is a fall prevention program with our nurse, Ann Burnick, who will, and that's grant funded. So she will come into an individual's home, 65 and older, or if you're a caregiver for somebody who is at risk for a fall, to do an assessment of the home environment, also review the prescription medications to make sure that there's not a conflict that perhaps could be causing a balance or gait issue. And that has been very successful. But again, our goal is to prevent the fall. We really don't want to come in after you had the fall. Our goal is always prevention.
So how would they contact you if someone had an interest in that service in particular?
The information is on the town website. Again, they can call our health department at the 203-294-2065. But Ann Burnack, our nurse, her information specifically is on the town website under the health department.
Great.
Under our Healthy Wallingford initiative, we have a new initiative called Eat, Play, Unplug. And I'm just going to break that down for you. Basically what it means, how it came to be, is that we in our community, no different than any other community, are overly stressed. We feel that we are being torn in every direction, and honestly, we're losing our civility, we're losing our empathy towards one another, towards a community. And in order to have a healthy community, you have to have a relationship with your neighbor, with your coworkers in a healthy sense. So the Eat, Play, Unplug is really a reminder to us about eating healthy, exercising, getting the proper amount of time that we need, and unplugging, disconnect. We are connected 24/7, whether it be to our iPhones, to our cell phones, to our computers. Disconnect. It's okay to say, I am not available for the next hour. It's okay. And so we're trying to work with all of the segments in our community to get that message across, to go back to our values. What is it to be a healthy community? What is it to be a good neighbor? So we're going to try to be unfolding, if you will, through every segment, a word of the quarter, such as respect. How do you model respect? How do you model it in your workplace? How do you model it in your community, in your church, so that everybody gets that same message? Let's come back to being a healthy community. Let's unplug. Start talking to people. And it's really missing. And you can see it when people are short at the red light, people are short in the bank.
Yeah.
Everybody's angry. Decompress. Let it go.
So that sounds like a great idea. If there's a business owner or an organization that's kind of interested in getting more involved in that from the community side and just promoting it and getting information out, how would they, where's the contact process for that?
Contact is me, same, at the Wallingford Health Department, again on our website, but our same number. We're also asking individuals to, there's a video clip that was presented by the Wallingford School System and Dr. Menzo, which basically the message is that everybody you know is dealing with some sort of problem. So be patient. Kind of take a step back before you explode. Shouldn't explode at all, but breathe. Be kind. It doesn't cost anything to be kind. It's a message that we've lost in our community. I'm going to kind of fast forward to our volunteers. We have a group that's called the Wallingford MRC, Medical Reserve Corps, which are both medical and non-medical civilians or residents in our community who volunteer, who give back their time with the purpose of helping the town in the time of an emergency, such as that we're seeing now with all the hurricane victims and the sheltering. Our volunteers play a crucial part if Wallingford were impacted and needed to open a community shelter so that somebody has a place to go to get out of the storm or a place to temporarily stay while they recover. I mean, ultimately, the shelter should be the last place that you go. But if you need to go, if your house is not safe, if there's a natural disaster coming, an ice storm, no electricity, and you need a place to go, we need volunteers in our community to help us man that. And that's what the Wallingford MRC does. They also have an important role from a public health aspect. We have a primary responsibility for medication distribution in time of a biological event. Lord help us. But if it happens, we need people. So right now we have about 103 individuals who are volunteers. We need 3 times that amount of people to help us through if something actually happened. So we will be having a recognition and a swearing-in ceremony. We have trainings that are available to the public for anybody who is interested in joining or learning more.
Great.
Again, on the town website, or you can contact me directly at the health department. Part of our trainings, we give first aid training, we give CPR training, mental health first aid training. We recently just held a training called Active Shooter. It's very sad that we should even have to think of this. We're going to redo that training in light of things that have been happening in our world. Haven't picked a date yet, but we will do that training again on a Saturday, again, for the whole community. It's called Run, Hide, Fight. If you ever find yourself in that situation, what to do. It's a wonderful training. It's given by our Wallingford PD. And when we have the date, we'll pass that information along to government TV.
It's sad, but very true that that's just something people need. That's information people need to have these days.
Absolutely.
Absolutely.
I wanted to touch base a little bit on Ken and the Coalition for a Better Wallingford. And I know that Red Ribbon Week is coming up in the end of October. And so I went back and I looked at the new legislation concerning opioid drugs and prevention, because clearly as a health department, we want to prevent. And yes, we're in an epidemic right now. So I want to go through and talk just a little bit about the law.
That'd be great.
So in 2016, Connecticut enacted law that said that the max prescription for at one time that could be given for an opioid drug to an adult was 7 days. Before that, the average prescription was a 12-day prescription. The current law now extends that to children, so a minor cannot be given an opioid prescription for more than 5 days. So big difference there. If you follow that back to 2012, the average amount of days that was prescribed, one prescription, 86 days.
That's amazing.
It is amazing. Clearly, we have a problem, not just in Wallingford, but in our community. And so, yes, the legislation is coming forward to try to help stem the problems that we have. The other thing that they have incorporated into the law is the prescription monitoring and reporting program. It used to be voluntary. Now it's no longer voluntary, so that if a prescription is issued for an opioid, it needs to be put in through the electronic system by the next business day. And this will prevent multiple pharmacists from giving the same prescription or a similar prescription to the same individual.
That's a great advantage.
It is a great advantage to stop the drug seeker.
Yep.
Some of the other things that are part of the law include that the prescriber, now when he writes a script for a patient, he has to say certain things to them. He needs to tell the person what are the risks of an opioid prescription. Talks about the risk not only of taking the drug, but the potential risk of an accidental overdose. They need to talk about the risk of mixing the opioid with another drug, including alcohol. And they also have to say, why are they giving you this drug? In addition to that, there's another part that says that they have to have a voluntary non-op directive form, so that after going through this information and you say, oh, I don't want to be issued this drug, is there another drug? There's a form that goes in your medical record so that if you aren't able to say that, it's in your medical record that says, I do not want a form of an opioid drug. Very important. They also now have an insurance coverage so that if you are diagnosed as having a substance abuse problem, your insurance company, assuming of course you have insurance, has to pay for the detox. Again, not optional. This is a public health issue. This is a medical issue. Individuals who find themselves in that position need help.
That's a serious change, dramatic change from what it's been in the past.
Absolutely.
Parents will be happy to hear that.
Yeah, no, and it's all good. We're going in the right direction, but clearly there needs to be a concerted effort. And that's what we're doing not only in Wallingford, but the state is trying it. So Wallingford, through the coalition and the community partners, are trying to be the place, a safe place for folks to go to talk about it if you know somebody or if you yourself have a problem. Take away the stigma.
Yeah, it's amazing and gratifying to see, 5 years of work that's paid off for getting these issues on the table and fixed. Well, I appreciate the effort you guys are doing, and keep up the good work. And thank you for joining us on this segment of Profiles of a Caring Community.